Hello, my name is Nathan King, and today I'll be talking about mental illnesses in veterans. So throughout the past 14 years, there has been an 86% increase in veterans who have died due to mental illness. This is a huge problem that this country has been facing ever since soldiers started serving in a war. Thankfully, there are new ways to combat and sometimes even cure mental illness. To start out, the major types of mental illnesses include depression, post-traumatic stress disorder, which is also known as PTSD, anxiety, and bipolar disorder. So PTSD, which is the most common type of mental health disorder veterans go through, is a trauma-related illness. An example is if someone witnessed a life-threatening event such as terrorism or death through combat. Individuals diagnosed with PTSD usually relive these events through panic attacks, nightmares, and flashbacks of the traumatic event. Although this sounds horrible, there are ways to cure this mental illness. These methods are primarily through therapy. There are many types of different therapy. For example, the most efficient form of therapy is called cognitive behavior therapy, CBT. This is a type of psychotherapy where a patient would sit down with their therapist, talk about their condition, well-being, and ultimately healing the patient. A recent meta-analysis found that 67% of these patients who went through this therapy no longer met the criteria for the disorder. So that's great news. Soldiers returning from deployment also suffer from depression. This is one of the most prevalent mental illnesses among veterans and is quite costly to treat. The diagnosis rate of this is 14% to all veterans, although many believe depression is underdiagnosed. Depression is typically linked to a PTSD because of the challenges experienced by depressed people. Despite its devastating effects, depression is treated with an 80 to 90% success rate. Treatments include medication, psychotherapy, electroconvulsive therapy. Schizophrenia is also a psychiatric mental illness associated with veterans. People suffering from schizophrenia tend to have delusions, hallucinations, and lack of concentration. This disease is most common with patients between the years of 17 and 30. A study showed this disease was associated with more veterans than it does the actual general population. Another study showed this disorder was the most common with poorer veterans as opposed to veterans with more money. Approximately 120,000 veterans were diagnosed with schizophrenia since the year 2000. These people have poor judgment when it comes to sounds and will sometimes hear sounds that aren't even there. Misconceptions and mental illnesses in veterans that are popular in society can actually prevent veterans from pursuing treatment. Many people view mental illness as a sign of weakness, which can have a huge impact on the way veterans view themselves. Ultimately, these misconceptions lead to worsened health, damaged and or broken relationships, and negative impacts on other soldiers. Many veterans try to ignore the fact that they have a mental illness, which actually does more harm than good. This actually leads to more disorders, addiction, and sadly, suicide. It is important for people to talk more about mental illness among veterans. Thank you.